Good evening, everyone. Let me see. Has Dr. Dance joined us?
Not yet po.
Wala pa, no? Wala pa. Okay. Going to be a very interesting evening if Dr. Dance won't be able to join us. But we've been communicating with him pretty much. I see. Our topic today is primary care, the role of primary care and health information systems in operationalizing Pagtanaw 2050. We are looking forward to having Dr. Dance join us, but I don't see his name here yet. But hopefully we'll get an insight if he joins us as to where is the Philippines in primary care. Where will it be in 2050? And more importantly, how are we going to get there? We may have to be a little bit more flexible today and maybe kind of change the program a little bit. Hopefully Dr. Dance will join us. But the program this evening is that we'll have the president of UPMASA give the opening remarks, followed by the presentation of Dr. Dance. If Dr. Dance is not here, I see Dr. Dennis Batangan. Hopefully he can give us an insight as to what is happening. And then there will be an answer and question period in which Dr. Vicky Herrera will be hosting. And then followed by the closing remarks of our president of PAASE, Dr. Marge Peña. So Dr. Bantagan, are you with us?
Yes, Dr. Cabellon. Good day, everyone. I'm here.
Yeah,
I'm online. Thank you.
Perhaps let me introduce Dr. Bantagan. Dr. Dennis B. Bantagan actually was an author of Pagtanaw 2050, where he was the, I guess, promulgator of that when I was looking as to who did the work in putting Pagtanaw for 2050 for the Philippines. Dr. Pagtanaw is an MD. I believe he also comes from the University of the Philippines. He has a Master of Science from Germany at Heidelberg. He is a public health specialist and social science researcher affiliated with the School of Social Sciences, Research Council, and the Institute of Philippine Culture at the Ateneo de Manila University. As I said, he earned his Doctor of Medicine degree from the University of the Philippines, Manila, and a Master of Science in Community Health for developing countries from Heidelberg University in Germany. Dr. Bantagan's work focuses on community health systems, health policy, and digital health innovation in developing countries. He has served as a researcher, faculty member, and a policy advisor, contributing to health systems development and e-health initiatives in the Philippines and Southeast Asia. His career integrates clinical practice, academic research, and public health policy with particular emphasis on strengthening community-based health programs and improving access to health services through technology and social innovation. Sir, I'm going to put you in front today as we wait for Dr. Dance and see if you could give us an insight as to where we are with primary care and how you came about with Pagtanaw 2050. Sir, the video platform is yours.
Thank you, Dr. Cabellon, and thanks to PAASE for this invitation. Allow me to upload my slides for this particular presentation. I actually prepared as a reactor for this particular presentation, but I also added a few contextual slides to be able to explain more clearly the context of my my reaction. Thank you for the introductions. I'm with the Ateneo de Manila University, as mentioned by Dr. Cabellon. And my role
Before
in
you
Pagtanaw.
proceed, Dr. Batangan, after you're done, I'm going to call on the president of UPMASA to say a few words in between. Go ahead, sir.
Okay, thank you, Dr. Cabellon. Yeah, and my role in Pagtanaw 2050 actually is more of a contribution to the review process that is ongoing. And I'm aware that PAASE is one of the institutions that has been tapped to do also part of the review of Pagtanaw 2050. I think I've been introduced, so I won't go through this particular slide. So I have three main areas to discuss. The first is actually to provide the context to right to health, which is actually where all these primary health information system emanates from. And I'll move on to the role of health information systems in local health systems development for universal healthcare. And I would focus at the last part on an evolving techno-governance research and development agenda we call bridging governance and access technology in health. So why the context of right to health? Because this is where actually all the mandates, programs, policies emanate from as far as the Philippines is concerned, and it's actually enshrined in our constitution. The 1987 Constitution says that the state shall protect and promote the right to health of the people, as well as in international covenants like the one in state listed here on NESCAP. The state recognize the right of everyone to the enjoyment of the highest attainable of health. And this is actually the context of the Ambition natin 2040 and the Pagtanaw 2050. In Ambition natin 2040, the health aspiration as articulated states that by 2040, Filipinos shall enjoy longer and healthy lives with minimal socioeconomic and geographic disparities in health status, which are comparable to residents of high-income countries. Filipinos are empowered and active participants in healthcare and secure in their knowledge. So these are the sort of the national aspirations, articulations of these aspirations for health. The right to health was also the context for the approval of the universal healthcare. And you will see here again another aspiration for universal healthcare. Every Filipino has access to quality, affordable health services when and where they need them without ever falling into financial hardship. And this is where we locate digital health or health information systems as part of the governance pillar of the reform agenda for the country. And what is the aspiration? What is the idea for the universal healthcare? Universal healthcare is actually intended for all Filipinos to be covered by basic health services through a financing mechanism that is provided by the Philippine Health Insurance Corporation. What has been introduced is actually the primary care provider, the healthcare provider network, which serves as the, in a sense, the one that will direct, the one that will provide the primary care benefits, and of course direct patients to higher level services as needed. So what is essentially done, or what has been uh, the direction that has been set is toward more local health system development through what we call the province and citywide health systems as part of the universal health care. But as we all know, this decentralization devolution process started in 1991 with the local government code. So this is a continuing process of decentralization with more authorities and resources being given to local government units. And what are the expectations with the local government, provinces, cities? They are expected to do integration, managerial, administrative integration, financial integration. So what's happening essentially is that you have local health systems that are more and more autonomous, with more and more authority, and with resources being managed essentially at the province and citywide health systems. So from that context, I will now move into the role of health information systems and local health systems development, as we are actually seeing, or the direction set by the Universal Healthcare, Local Government Code, and even the Mandanos-Garcia ruling is actually for local health systems development in support of universal healthcare. As far as the health information system is concerned, prior to the universal healthcare, the context was purely having a national, or what we call the Philippine Health Information Exchange. But with the universal healthcare and other issuances that I've mentioned here in terms of the localization process, for health information systems, there will be more and more local health information exchanges managed by the local government systems. So I've listed here, for example, the BARM. BARM is an autonomous regional government, which will have eventually its own health information exchange, similar to province and citywide health information exchanges that are evolving in the country. In fact, earlier this week, we were with the Department of Health and Aklan province provincial health office as they launched the Aklan local health information exchange. Parallel to that process of developing local health information exchange under the universal health care, we have the creation of the National Health Data Registry under the management and oversight of PhilHealth. And fortunately, under that particular National Data Registry, it was recognized that the decentralized dataset submission model was actually, meaning provinces, cities, and other national government agencies can actually submit information to the registry, National Data Registry, through an intermediate layer. Moving on to the work that we're doing on bridging governance, access, and technology in health, we were fortunate since 2013, 2014 to be able to participate in the National Unified Health Research Agenda of the Department of Science and Technology. As you have seen in this particular slide, the National Unified Health Research Agenda is part of the overall harmonized national research and development agenda of the country, which actually supports Ambition Natin 2040. Pagtanaw 2050, I understand, is along the lines as well of this Ambition Natin 2040, and even going beyond this particular vision of 2040. The technical governance work we have been doing on health information system actually started around 2014, and it was around that time that we started prototyping an EMR and moved actually to more analytics work, and now we're moving into more local government focused work through I'll introduce this later, the SMILIS, or the Smarter Integrated Local Health Information System. The overall direction for HIS in support of primary healthcare and universal healthcare actually is to be able to support the integrated province and citywide health system delivery of services, including, of course, the financing mechanism for it. So this is actually a borrowed slide, no, from the Department of Health. A lot of my slides actually borrowed from the Department of Health because it actually, uh, 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 I think, that can present, no, in a more visual form the ideas about primary healthcare and health information system. Moving on, or sort of going back, no, into the work that we've been doing for the National Unified Health Research Agenda in support of local government units. Way back in 2017, we were able to do a local health information exchange prototype for a municipality in Pulilan, Bulacan. This was supported by the Department of Science and Technology. This was followed actually by another prototype for a local health information exchange in Cagayan de Oro City under the time then of Mayor Oscar Moreno, and they supported the development of a prototype for developing a local health information exchange for a city, and eventually another project with the Department of Science and Technology for Pangasinan. So the series of projects actually, this slide came from the Department of Health because they're now assisting local government units to develop their local health information exchanges. Just to highlight some of the work, including the resources, knowledge resources that's been developed across the implementation of this project. Since the work that we're doing is more R&D, research and development, on with an implementation research approach, we are actually producing these documents so that these can be resources later for other local government units that would want to pursue a local health information exchange. And then finally, the last part of my presentation is actually focusing on the bridging governance access in health as a techno-governance research and development agenda. As earlier mentioned, we actually started doing the work as part of the research agenda in support of the National Health Unified Research Agenda, which actually also supports the Philippine National Health Research System. So we actually have three themes, no, in this research agenda: health policy, health programs, and capacity building. We were able, or this actually was also presented in the Philippine National Health Research System conference in Tacloban, and also with the National Academy of Science and Technology. These are the themes, no, thematic studies that we've been doing, and I'll sort of give an examples of some of these thematic studies, including this MILIS, which actually is really intended for health information system integration at the local government. So the first cluster is actually on transformative health policies. This is where I'll be sort of describing briefly the work that we're doing for traditional medicine with PITAC, no, Philippines Institute for Traditional Alternative Healthcare, and also a foresight study that we started here in Ateneo. For cluster number 2 on inequity issues in health services, this is actually where we locate the work on the smarter integrated local health information systems. And the support for capacity building is actually seen also as a part of the smarter integrated local health information systems initiative. So going back to the first cluster of access to transformative health policies, we are actually working now with the Philippine Institute for Traditional and Alternative Healthcare in developing a electronic recording and reporting tool for traditional medicine, traditional and complementary medicine, starting with acupuncture. So we already have the prototype for this particular recording and reporting system, which is actually more on our research and development process to use electronic to have an electronic form of reporting. And I see actually one of our partners here from the Region 2 Trauma Medical Center who contributed actually to the development of this particular prototype. The foresight study that I mentioned earlier was actually part of a fellowship that I had with the Ricardo Leong Institute of Global and Area Studies, which is actually a more of a methodological study on Philippine foresight. I just mentioned it here, but I will not go into the details of this particular study. The SMILIS project, which we started circa 2013, 2014, actually was really focused on local government units as the node and the focus of the implementation. Knowing very well that when we talk about health technologies, information systems, we are not just talking about TMRs, we're talking about different types of systems in public and private facilities. We're talking about data from other agencies, for example, from the social work, from the Office for Senior Citizens, and also the national programs such as the Pantawid Pamilya program, ACAP, and so many others. So the idea is the framework actually is to be able to assist local government to be able to have an integration framework, a public infrastructure, so that they can integrate all of this into their respective evolving system. So this is the Smarter Integrated Local Information System prototype developed, as I said, not through a series of projects since 2016, 2017 with the UST and also with the city of Cagayan de Oro. And what's shown here actually is the architecture, the Open Health Information Exchange architecture. I won't go into the details, no, but this is the architecture that we have developed and showed to our partners. What I would like to highlight here is that we link this architecture to their major final outputs, no, for their UHC local health system maturity level implementation. The high-level design, no, for this particular smarter integrated local health information system actually looks at a process wherein we have to accept, no, on the right-hand side of the slide, that there will be a lot of information systems, CMRs, apps, registries that needs to be integrated in any exchange, whether at the local or national level. And what we need to sort of adapt is the prescribed technical solutions like the HL7 Fire, prescribed by the Department of Health and Field Health, and use authoritative registries, no, the third column on the diagram, so that eventually every system could submit to the National Health Data Registry. So this is a high-level design framework which we actually have recently published actually in a journal article, and what we see on the left actually is a local issuance from Pasig City adopting such a framework. So what we're doing actually is trying to merge, no, weave in the academic research work that we're doing into actual local government implementation. Last few slides, part of the research that was funded by the Department of Science and Technology on SMILIS, we actually had some workshops, not to be able to have a scenario setting in terms of SMILIS research and development scenarios. So we look at the first 5-period scenario, for which we are still in at the moment, focusing on community-based hubs and institution-based hubs. So this is more a foundational approach, no, in terms of having integrated health information exchanges. But at the same time, we should already, because the Universal Healthcare Law actually really specifies the direction towards National Health Data Repository, so that that should include actually even at the earliest phase. The second phase is actually having city and province-wide health system models. No? We're seeing that already at the moment. There are already some provinces they're probably not calling them integrated health information systems, but they are moving towards that type of integration. So we see that moving into the second 5-year period from 2029 to 2033. And of course, still convergence with the National Health Data Repository. For the third 5-year period, we are, in a sense, projecting and hoping, of course, that this actually moves, that other social development information systems can be now integrated into the local health information exchanges. The key to this actually is the Philippine IT system, for which there are already prototypes or models of integration, because the social development and other social protection programs actually integrate or merge actually with the citizen. And the way to be able to have the convergence also benefits specific citizens is to have authoritative citizen registry, which we now can use actually the Philippine ID. So we are making a distinction between the processes between cities and provinces because of the political structures, the difference in the political structures of cities and provinces. It's actually more complicated in the provinces because of the component municipalities and cities which the province will have to manage as well. Similar to the first two phases, the constant sort of collaboration and development for the National Health Data Repository, because under the law, that is the default repository for the universal healthcare. The fourth 5-year period up to 2039 to 2043 is the period wherein we hope that there will be longitudinal studies, longitudinal registries across the life stages. There are already some longitudinal registries in the Philippines, but these are mainly university-based, mainly for research and development purposes. And we in this particular scenario, the idea is to have longitudinal registries in cities and provinces as prototypes. This is also part of the enterprise architecture design that was presented by the Department of Health in the longer term. Sorry, slides. So I think the last slide actually is moving. Sorry, the slide is not moving from my end, but the last slide actually looks into the fifth and sixth year period. The fifth 5-year period is actually projecting or proposing that we move into regional health information exchanges, meaning that provinces and cities within particular regions will now have a separate or a regional health information exchanges, because as we are seeing now, the developments are actually more at the province and city levels. So, for example, you will have a regional health information exchange for Region 1, another exchange for Region 2, another exchange for Cordillera Administrative Region, another exchange for Bangsamoro Autonomous Region for Muslim Mindanao. So that in the last phase, which is up to 2050, 2053, it will be a national health information exchange, but could now be a federated health information exchange across the different regions. This actually is a sort of a long-term perspective, no? And it could probably it can happen earlier, no? But I hope, no, that this particular sharing allows us to be able to think through for Pagtanaw 2050 and perhaps be able to contribute to the thinking and planning process for Pagtanaw 2050 for primary health care and health information system. So thank you very much, and good morning, good day, good afternoon.
Thank you very much, Dr. Bantagan. Before we go to our question and answer period, Madam President of UPMASA, would you like to kind of with your opening remarks, excuse for the we're all crisscross here. All right, Madam President, you're on.
Well, I actually prepared what I was going to say with Dr. Dan's presence. Thank you so much, Dr. Batangan, for your presentation. And it's really good to see that there is a robust agenda towards a national health data repository. My expectations more on the clinical side. I was thinking that I was so excited about understanding how the health information system is going to be structured to support primary care facilities such as clinics, family practices, community health centers, and barangay health stations, which serve as the first point of contact between patients and the healthcare system. Because through an effective HIS, these facilities can collect and manage health data, monitor patients over time, and use this information to improve patient care, strengthen public health monitoring, and guide healthcare planning. So, in a country like ours, strengthening primary care through a robust health information system really has the potential to greatly benefit our poor kababayans. It can improve access to essential services, reduce healthcare costs, support disease prevention, and promote more equitable healthcare delivery. So I was going to ask Dr. Dance, who has an expertise in cardiovascular diseases, about making sure that there's going to be stronger preventive programs, better screening strategies, earlier detection, and more effective treatment, which will significantly reduce the mortality and morbidity associated with cardiovascular disease, which is the leading cause of death in the Philippines. And I'm also excited to see that with a strong health information system, it will make it easier to track and respond to infectious diseases such as dengue, tuberculosis, and measles, allowing for more timely public health interventions. So my perspective is more on the clinical side. Thank you.
All right, thank you, Madam President. Dr. Bantagan, you're our primary resource person this evening. Then I'm going to turn over the platform to Dr. Vicky Herrera. Dr. Herrera is from Boston University. Is the daughter of an associate justice of the Philippines, and also the daughter of a dean of my beloved medical school. Dr. Herrera, you proceed with the question and answer period, if you may.
Sure. Thank you, Billy. Thank you, Dr. Batangan, for your wonderful talk. It's been very enlightening. Are there any questions? if I may start, well, also Cecile, your perspectives on the clinical, issues for primary healthcare. So let me start with a question, and then others perhaps may pick up. I think it's really amazing that you have this great plan from with goals for 2040 and 2050 for a health information system. I was just wondering about, I know it's very complicated, but how real time will this health information system be? In other words, from the data collection, data input, and then being end users being allowed to use it. Because all our goals will really depend on that ability for real-time monitoring, real-time research, etc. So how do you build that in? Because I know it's so huge, it's a lot of data.
Thank you, Dr. Cabrera. Herrera. Usually on the input from Dr. Cecil, I did not actually include in my presentation, but we're also doing some work on non-communicable diseases, specifically, but it's still focused on local government electronic recording and reporting. We're doing that in Pasig City and in City, and the system actually is able to document or in electronic form the risk assessments done for hypertension, diabetes, cancer, and prevention of blindness under the non-communicable disease program. And there is a dashboard that our local health officials can actually view real time, as well as the local chief executive. Also, as an input or initial response to your question, Dr. Herrera, a lot of the work is actually capacity building because technologies are available. And there are a lot of projects, a lot of providers as well who could sort of deliver these real-time data and real-time data. But the concern actually is institutional and individual capabilities to be able to shift into the digital mode. That's also the reason that we included in our Bridging Governance Access Training and Technology Research Agenda a capability or capacity building component really focused on local government units. And the capacity building actually starts with policies, understanding and being able to set up the correct policies at the local government level. As the provinces and cities will be the one implementing the national programs. So they would need local focused policies, and then of course capacity building. For the capacity building component, what we have started again as part of our SMILIS project is a modular. We are offering 7 modules. These are modules that are periodically provided to the local government units as needed. But it starts with actually a design thinking workshop and moves into policy planning and costing for the system, and to the more technology-driven aspects of AMRs, dashboards, and more analytics in the later. I hope I saved this answer. Over.
Yes, thank you. Cecilia had a question. Or no?
Dr.
You're
Batangan,
muted.
I do have a question. I do have a question, sir. What is the present status right at the moment as to the use of electronic medical records in the Philippines. And the question is, what I'm concerned with is that, you know, I retired from the United States Army Medical Corps, and my hospital is Walter Reed Army Medical Center. You know, of course, the highest, the pinnacle of the military system. And they have an integrated system. Whether I get sick in the Philippines, whether I get sick in Germany, they're able to tap into my medical record. What are my medications, and what are my medical problems, and proceed right at their fingertips. So when we first dealt with this at Walter Reed Army Medical Center, they had to change software almost every 5 years because one software company does not talk to another company. So at present, where are we with regards to electronic medical records? And what is the major challenge in implementing this system so that if I get sick in Ilocos Sur, for example, I would be able to be treated in whatever, if I am in Davao, and be able to do it. So I'd like to see what your perspective is in the challenges in getting this implemented.
Yeah, thank you, Dr. Cabellon. Exactly what you said. No, there are different providers, different technologies that seem to be operating on its own. No, we're seeing that also in the Philippines. What the national government did actually was to establish standards in terms of accreditation and certification of what they call the health information technology providers. The plan or the policy is that should actually be consistent or between the PhilHealth and the Department of Health. But it's easier said than done. No? There are a lot of providers. There are a lot of technologies that have been deployed, no, in different systems. So the challenge now is how do you move into interoperable systems. So there was an attempt to do that, no, for the Philippine Health Information Exchange. I think that was around 2010 to around 2020, but it encountered a lot of challenges, so it was not pursued. And then we had the universal healthcare. Under the universal healthcare, the entire sort of setup was changed to more local, province and citywide health system. So now we're dealing with more fiscal and political autonomy of provinces, including the implementation of their health information systems. And the challenge now, actually, for national government is how to have exchanges across these different local systems. For the private sector, the network hospitals, I think what you described in terms of interoperability is already happening. So if you have a network hospital, for example, in Cabanatuan City that is linked to a hospital in Cabanatuan City linked to a network hospital in Manila, no, your record can be shared between those network hospitals, no. But for the public sector, it's not yet happening, no. We still see there are still a lot of problems in terms of exchanges, and one of the main things is data sharing, no. There are very stiff penalties, no, on data breaches. So a lot of people, a lot of institutions actually hesitate, no, on the data sharing aspect because of the penalties associated with breaches in data management. That's also the reason that we proposed a sort of a multi-year phasing of the health information system development in the Philippines as part of a contribution to a developmental research and development process. And hopefully that's something that can be discussed further, or probably be included in some planning processes, so that we have a phasing of the development of information systems in the country in the next 30 years or so. Over.
That's great. We have a couple of
Maybe
questions.
follow-up question. Follow-up question.
Sure, Billy.
And
Go ahead.
so this is a initiative for the public part of health, but I believe there are HMOs or private insurance in the Philippines. How vigorous is their health information system? Suppose you are you're a client of theirs. Are they pretty well supported now? Do they have a data center? If you are sick and you're part of, I forgot a private HMO, where they do have a system on their own that can take care of their clients. How is that maturing in the Philippines? The private sector.
Yes, Dr. Cabellon. For the private sector, if you are part of their network, including the health insurance part, no, so the health service delivery part and the health insurance part, some companies actually have combined services, no, the insurance and of course the services part. So if you agree, there's of course that consent part, no, that to be included in that particular system, including the sharing of your data to their network, then your data can be seamlessly transferred, no, within that particular network. So I think the private sector is more advanced, no, in interoperability, precisely because they have so authority over the network, and they also have the same technology. They can ask all their participating units and to use only one system for their particular implementation process, which is not true in the public sector. In the public sector, the different providers actually goes through different contracts from different providers. So they have the authority and flexibility to choose their provider. So what they will just have to make sure is that this provider is actually certified and accredited by the national government agencies. There is also the Department of Health provided system, which is free. iClinic Sys, no, as an EMR, and also the iHome is for the hospital system. These are provided free to the local government units, but there is also issue of interoperability even within that single system provided by the Department of Health and PhilHealth. So a lot of technology development input still needed, of course, guided by policy eventually, no, for health information system development in the country. Over.
Thank you.
Thank you. There are two questions in the chat box. Let's see, John D. Flavier, would you like to raise your question, or do you want me to read your question in the chat box? Anyway, John D? Nope. So John D. Flavier was very thankful for your talk, and the question is, please enlighten us on how much of national health funds have actually been transferred to provinces and selected cities as mandated by the UHC law. Has information on funding transfer to LGUs been monitored?
Yeah. Well, this is a very sticky issue, no, regarding funds. So under the universal health care, there is a provision for the creation of a special health fund under the control of the local health board. And the special health fund actually is a composite fund, no, coming from the national government, the Department of Health, coming from the Philippine Health Insurance Corporation, and even congressional and local funds. The first item that was request in terms of being able to set up or to manage that fund is, of course, the creation of a board, no, specific for the universal healthcare implementation. And of course, the guidelines in terms of the mobilization and management of these funds. There are varying experiences, no, in various provinces and cities on how these funds are managed, no. But I think the most sticky part, is actually the PhilHealth benefits benefit funds, no, that should be given for the primary care provider services. So initially, when the universal health care was started 2019, around 2021, 2022, I think, there was a model for what they call advanced implementation of the universal health care, when there was downloading of funds even before services are provided. So there were some provinces that were part of that initial pilot implementation, wherein they already got the money for the services that they were supposed to provide to their PhilHealth beneficiaries. So the idea there is to push the local health system to be able to integrate, to be able to improve services and then deliver the services. But that had problems, particularly with the Commission on Audit, in terms of the downloading of the funds to local government units. The Commission on Audit was saying that you could not pay institution before services are provided. So that had problems. So I think they're not continuing with that process anymore. Now they're moving into sort of payment after you are able to provide the first encounter, patient first encounter. Under the universal health care, for the primary care benefit package, there's a certain amount that the Philippine Health Insurance Corporation will pay for each individual that is provided with primary care services. So there's the first tranche and then the second tranche. For the first tranche, you will have to provide evidence that you have done your first patient encounter with the patient. I think the experience of Dr. Dan's in Batangan actually would show that, no, that they're doing that actually in some provinces, particularly in Batangan, because I heard him speaking once on the Batangan experience. And then you use that money now, the money that you receive from PhilHealth, to be able to manage the services within the locality. The fund from PhilHealth should go to what they call a healthcare provider network. It should be a network. So the province and the cities would have to actually create or declare their healthcare provider networks, because the money should go to that network, and the network is the one that will sort of distribute the primary care benefit funds to the participating facilities. So it's a bit complicated administratively and financially. And a lot of the problems that the provinces are reporting is along those lines of setting up the network, setting up the fund management, and then eventually, how do you distribute it evenly to the participating institutions and facilities? Of course, the setup is different with hospitals, no, because with hospitals currently we have case rates. So the hospitals can have independent individual claims, no, public and private hospitals, on PhilHealth members who actually avail of services from the hospital side. I think it's more defined in the hospital claims, no, compared to the public health side. Over.
Right, thank you. There's another question from Liesel Francisco. Would you like to ask your question, Liesel, if you're still on? If not, I will read the question. Liesel, would you like to? Okay. The question pertains to confidentiality of the data. How can health-related information systems ensure the protection of patients' sensitive personal health information while still allowing authorized healthcare providers and government agencies to access data necessary for public health surveillance and service delivery? So essentially a question on protection of patient information.
Yeah, thank you, Lisa. Yeah, under current laws and guidelines in the Philippines, and of course, you mentioned the Data Privacy Act. The guidelines in terms of consent, no, is very well established. So hospitals or even public health facilities actually would ask, no, for your consent to be able to be included in the registry, and then also to share the data for reporting purposes. But of course, that does not guarantee any security, no, for your. So the security part actually lies with the institutions that are collecting and storing the data. Under, again, the Data Privacy Act of the Philippines, the institutions that are collecting and storing data are accountable, no, for any breach or any leak, no, in the data, and there's very stiff penalties for data breach. So that's one layer. The other layer that is provided by the Data Privacy Act is for institutions to have their data protection officers and their data protection manuals. No, the key there is actually for the National Privacy Commission in the Philippines to have a contact to institutions in case there is a problem in that particular institutions, and that's through their data protection officer or chief information officer. We have seen this in the past, no, that there are data breaches, and the rule is that if there's any data breach, if there's any problem in the data protection officer or the chief information officer should report to the National Privacy Commission within 24 hours the incident or the situation. Otherwise, if you don't report within 24 hours, then there is already some kind of penalty, no, that is being given to that particular institution. So that's the administrative part. On the technical part, a lot of technical solutions provided. There are also coming from other government agencies, from like the ICT, Department of Information Communication and Technology, and we have seen and we have participated in this good hacking exercises. I call vulnerability and penetration tests. No, meaning they will schedule a hacking situation to the systems. They will inform, for example, the ICT regional team will say to a hospital that within the period of Monday to Friday of this particular week, expect a penetration test in your system. So they will do a penetration test and then identify vulnerabilities of the system and then inform the hospital or the institution about these findings, including the more critical ones. No, so they have serious, very serious, medium, and low risk, and you are expected to respond to this within a specific number of days. So that actually can be done regularly, no, for institutions. Another approach that we have we started looking into is, of course, the identification and the data minimization. We actually have a prototype for that for a small research work that we have been doing, and we hope to do some more pilots, no, on the identification and re-identification protocols. so that what goes into the system is not the actual name but a hash. No personal data that goes into the system except the hash, no? And the hash now becomes your identity in the entire digital ecosystem. So that's something that we are looking into, one of the programs of the Department of Health that we are actually working on in 2 LGUs. No? So, over.
That's great. Dr. Pena, do you have a question? Marge?
No, I'm just listening to all of the
Okay.
the
All right,
proceeding.
all right, all right. If I may, how about data quality for future? I know you're just setting this up, but I know Billy's always going to ask, well, what about AI, large language models, and how will, you know, this would be perfect for an AI system wherein you can use the data, get the data, and then have real-time analysis for research, et cetera, and education, et cetera. Are you preparing the data for future integration into an AI large language model system, for example?
Yeah, thank you, Dr. Yeah, we have been, of course, there are available technologies and offers to collaborate. No? But with some recent developments and also policies, no, we've seen the AI Act of EU, the South Korean AI law, the Vietnamese AI law, and even the approach of some ASEAN neighboring countries in terms of the policy part, no, because that's where we're lagging behind. Because there are potential risks that needs to be mitigated, and we need to be covered by policies. There are some small studies being done, but without the large scale, without the national policies specific, for example, for the health sector, then there is some hesitation to move into more of these technologies. One preparation that we have been working on, again at the local government level, is to put up a layer of what we call safe data environment and exchange. This is something that we have seen with the UK, with Taiwan, with Japan, Australia, wherein the approach to data management is along a framework called safe data environment and exchange, which now provides the layer for data protection, including privacy and confidentiality. So we're now working with 2 cities so that layer of policy can be provided and can guide in the in the data management. And one of our partner cities was saying that we consider that as their foundational AI policy, meaning the adoption of AI technologies will now have to follow their safe data exchange and environment guidelines, which would mean that they would require AI technology providers to ensure that the safe data environment policies are complied. So that's one layer that we're seeing. We've been talking to some colleagues as well from other jurisdictions, and the same situation. The offer has been made in terms of the AI technologies, but they are hesitant because of consequences in case the policies are not yet there, and there are potential risks that or vulnerabilities that are introduced, then they become accountable. So that's the fear at the moment with the use of. But I think we can't go wrong, no, with foundational approaches or foundational policies, no, to support eventually some more AI technologies, use of AI technology. Over.
Thank you. That was very thorough. Are there other questions from the audience? You can raise your hand, do the little thingy with a raised hand. I have another question, Dr. Batangan. Would you use your safe data environment layer? Would you make it universal for everyone? Because I'm thinking the interoperability seems so burdened if everyone was going to have their own system. But if we would go with a safe layer, the safe data and protection layer first, right? You call it an environment. That might be an entry point or foundational layer for the research, or for integration of the whole system. Would you agree with that? Rather than allowing multiple, different systems, that should be the first one, I don't know, intuitively, be the first one to make it universal. So then you can have real-time monitoring, surveillance, and research as well.
Yeah, I think that will really, really help provide a sort of probably a more acceptable platform across the different exchanges. It's just that it has to be sort of be made as a national policy if we want other exchanges to use it. We have seen in other countries that they use it because they have a sort of integration of exchanges at the higher levels, regional or even national levels. So they could actually provide that safe data environment exchange layer to be able to provide a more accessible layer of data protection. Since this is something new, because the approach in the Philippines has been, in a sense, punitive, with the Data Privacy Act, penalties, providing penalties for data breaches, which I think is acceptable and provides all sort of accountability. So what we're trying to introduce as well is a more positive approach in terms of data management, which is safe data environment, and how do we ensure safe data environment for service delivery and for research. So if hopefully if we are able to set that up in 1 or 2 cities in the Philippines, again as an R&D, research and development process, then it would serve as a model, for other local governments, even for the national level. So I'm just highlighting the fact that the contribution that we're making is more on an R&D phase, and then offering that as a possible option, for the national or regional systems. Because as a small team in the Ateneo de Manila University, we could only do as much in terms of trying to unpack some of these issues and try to prototype or think through in terms of possible technical or policy solutions, and then offer it as and I think the Pagtanaw 2050 is one way, of putting together all these research and development input from different sectors and be able to sort of consolidate them at some future point, or probably as they are happening, so that they can contribute eventually to the evolving ecosystem, which is, as you know, very complicated and very challenging.
Yes, thank you, Dr. Batangan. We've peppered you with lots of questions. You're in the phase of building it up, R&D at the same time, thinking of future, and also informing policy. I think that's a very nicely integrated system. I don't see any more questions. Billy, I turn it over to you for next. Who's going to give the closing remarks? I know Dr. Dons was supposed to be here, but Dr. Batangan, you certainly filled the space excellently.
Before I give the floor to the president of PAASE, birthday pala yung resource person natin ngayon. Tama ba yun? Happy birthday, sir.
Yeah, it so happened.
Thank you very much for joining us. Thank you. Thank you very much.
Thank you. Thank you.
Madam President, what do you think of all this from a biologist to the trying to get this electronic medical from Batanes to Zulo? And how can PAASE accelerate this process is the challenge.
Well, thank you, Billy. Before I start, I would really like to thank Dr. Batangan for holding up and taking the lead tonight. It's very impressive when I was listening to what they're trying to achieve in the Philippines. And I know that in the US, we are getting our records coordinated in the hospital so that you can go from one part of the system to another within that same hospital, but I'm not sure yet that I can go from one hospital to another and see my records transferred that efficiently. But I'm really impressed by what they're doing. It started as R&D, and it seems to be heading to national. It'll be the path to nationalization, and in fact, so the goal of our webinars right now is really to address all the operational systems or operational areas of Pagtanaw 2050, which is the health systems. And the presentation that Dr. Batangan gave today really shows the way of how to get there. Little by little, city by city, by province, by institution, they are leading the way to get to the point where we can have all the data, like Dr. Billy said, that you can go to Batanes and get sick there and still find your records in the hospital that's being accessible so that they know your health outcomes. So this is really promising. And also, I'm really impressed by the fact that in the Philippines, they're actually aiming for universal health care for everybody, which is very contentious here in the United States. And so on that alone, I think that's very impressive. And so in any way that we can, I think our goal with PAASE is really to go hand in hand and see how we can disseminate information and how we can actually contribute to promoting all of these ideas and finding other experts to work with so that this can become a reality in 2050 and beyond. So I like the way that Dr. Batangan actually broke it up into 5-year periods, because we really cannot accomplish this in one big swoop. It has to be done a little at a time, piece by piece, like a puzzle, and then eventually be implemented in the country. And I guess that's what we're heading for. And so I really am very happy, Dr. Batangan, that on your birthday, you're sharing with us this project and showing us the way to get there. Really, I would have liked to also hear the clinical side from Dr. Dance, but I guess we'll probably have to hold that at another time, because hand in hand they should go together. So I'm very thankful that even though we have our one speaker here, and for all the questions that everybody asked to put this into perspective, that we have been able to address one very important issue, which is health in the Philippines. And so again, Billy, thank you so much for putting this together. And I would also like to thank Dr. Herrera for once again asking, really helping us ask the really pointed questions and bringing everybody together. And I also would like to thank President Passion Bregman for the second fruitful collaboration and partnership between PAASE and UPMASA. And I think we'll have more things to do in the future. And so basically, all I want to say is that, with Pagtanaw 2050, the vision is really to have it's really a vision for the well-being and the health of all of the Filipino people. And so making this primary care accessible to everybody, and building relationships with our healthcare providers so that we can not only be treated when we're sick, but also develop methods for prevention. This data, when it's all together, can actually be mined to actually find ways for prevention of many diseases, and also early detection and identifying who could be at risk for many diseases. And so that is the power of these databases if we are able to bring this into the future. And so for us, actually, as a biologist, we work in the lab, but now we are moving into translational research where we can actually work with clinicians and put what we find on our bench into practice and help make the patients healthier. And not just that, but actually, as a cancer researcher, it's mostly like early detection and prevention, identifying who was at risk and minimizing the risk. And so these systems that are being developed in the Philippines will really lead the way towards the development of that. And so the health system that Dr. Batangan actually described to us very extensively and very comprehensively today will allow us to make any decisions on many levels, not just healthcare to our patients, but also research forward to integrate whatever data that's there in delivering health to the patients. But like I said, this will not happen all at once. The conversations that we're having today with respect to all of these aspects will really pave the way. And all of these innovations and projects, even at the R&D level, are the ones that will play a very central role in developing what I think would be a smarter and more responsive health system in the Philippines. And so, again, Pagtanaw is a vision, and achieving the vision that we have for 2050 to where we want to be really requires a lot of collaboration across all the different sectors, not just among physicians, but also across many disciplines: biology, engineering, computer science, those who develop AI. We all need to be in it together. Not just working together, but also a sustained commitment from our government. And I can see that this is funded by the DOST, all of these, and hopefully it will be funded forward as we implement this into all the hospitals in the Philippines and all of the provinces. But really, it calls for a commitment with the government, academia, healthcare professionals, and also our citizens. I think our citizens will demand that from us. For us in academia, we are very focused on our research, but our research will not translate to the benefit of the patients without commitment from our government as well. So this is the partnership that I hope we will develop and begin to develop with PAASE, UPMASA, and everybody as we go forward through these discussions that we are having now. So again, thank you very much. I hope that the insights that Dr. Batangan has shared with us today will strengthen our commitments towards all of our endeavors. We're all pursuing many different things. Let's continue to do that, but let's also not forget to talk to each other and bring each other forward, because only then will the country realize what we have all invested our time, our money, our intelligence, our efforts, and our passions for. And so again, thank you to our speakers. I guess we'll have to invite Dr. Dance again. Thank you, Dr. Herrera. Thank you, President Pachon Bregman. Thank you, Billy, for making this happen. I know I can always count on you to tap to your resources and bring the best speakers for this. So again, and thank you to everybody who attended the session. I hope this has been very useful to everybody. I'm wondering if everybody can put their cameras on, and actually we can have a picture for all the attendants. Feb will take the picture for us.
Okay po.
To see all your faces.
1, 2, 3, smile. Another one po. 1, 2, 3, smile. Last one po. 1, 2, 3, smile. Okay na po.
Okay.
Thank you very
And so
much,
I think-
everybody, for attending. Thank you,
I
Madam
think we
President of PAASE. Always a
Yeah.
very inspiring closing remarks. Thank you very
I
much.
think we have a certificate of appreciation to present to Dr. Batangan.
Yes.
Feb? Okay. All right, so we present this certificate of appreciation to Dr. Dennis B. Batangan, MD, MSc, Heidelberg, for being our speaker at the Philippine American Academy of Science and Engineering, PAASE, and the University of the Philippines Medical Alumni Association in America webinar entitled The Role of Primary Care and Health Information Systems in Operationalizing Pagtanaw 2050, held on March 13, 2026, and presented on this day with our deepest gratitude. Yours truly, Marge Peña, President. Thank you so much, sir, for holding up, and yeah, so nice. And also at this point, I would like to invite everybody to our APOMs, our upcoming events. On March 27th, we have a celebration of women in STEM. Our speakers will be Dr. Eileen Cuelgas Orbecido, who is from the Department of Chemical Engineering, a full professor there from De La Salle University. We have Dr. Mary Lai Salvana, who is an assistant professor in statistics at the University of Connecticut here in the U.S., and Dr. Mary Ann Mata, who is a professor of applied mathematics in the Department of Mathematics, Physics, and Computer Science, University of the Philippines. I would like to invite you to listen to these very inspiring women and be inspired as well. So please join us on March 27th. Again, 8:30 a.m. for you, 8:30 p.m. on a Thursday evening for us here in the United States. And then, of course, we would like to invite you to APOMS 2026, our annual PAASE meeting and symposium. This will be held at Las Casas Filipinas de Acuzar in Bataan. So a very nice location on May 28 to 29, 2026. And this will be an in-person meeting. So those of you who can make it, yung mga malapit dyan sa Bataan, sige na, maglakad na kayo. I hope to see you there, and it will be a very exciting meeting, and we will continue discussions that will bring us to the future. So I want to thank everyone again for attending, and hope to see you again in future meetings and future webinars. Thank you so much.
Okay.
Thank you.
Thank you, everybody.
Thank you, Billy.
Thank you.
Thank you, everyone. Thank you, Cecil. Thank you.
Thank you,
I'd like
Marge.
to acknowledge Angie, our Vice President, who is there.
Oh, hi.
Yeah, she's a.
Yeah,
You go from the
very-
old me to the
very
young
well.
president. So that's the future.
Inspiring closing.
Yes.
Very nice.
Thank you. Thank you.
Always nice.
Thank you.
Mhm.